Lagos, Nigeria's largest city, could return to stern lockdown rules if residents continue to ignore social distancing. Nigeria's economic hub returned to work last Monday, ending a 5-week lockdown to curb the spread of COVID-19. However, since the easing of restrictions, people have thronged markets and banks. At the weekend, the city's governor, Babajide Olusola Sanwo-Olu, warned the lockdown could be tightened again if social distancing was ignored. Let's get you the latest from that country now. I'm joined by Abdel Kolade, a journalist from Lagos State Radio Services. Thank you very much for joining us, Abdel. Now, we always talk about the continent's most populous city when we talk about Lagos. Why is it, perhaps just talk us through, that it would be so difficult for people to social distance in the city, firstly?
Yeah, because of the nature of the city. So it's actually a bit, looking at the population, it's a population of 20 million people. And it's a bit difficult for people, although it is actually achievable. And that's what the government has done. You know, they are saying that, okay, yes, if we can get to the unions, for example, now the transport services, the national transport services, if we can get to them and talk to them, if we can increase our advocacy, it is actually achievable. Social distancing is still achievable. And if corporate organizations like commercial banks and other public and other corporate organizations that people use and go to, if they can actually issue guidelines for their customers, you know, for example, the commercial banks, the state actually had issues with the commercial banks when they opened on Monday. People thronged there in their numbers, and there was no social distancing, physical distancing whatsoever, because some of their branches were actually were closed. They didn't open all of their branches, so the few branches that they had, a lot of people went to that place and they actually didn't obey most of the safety rules issued by the government.
Right. And West Africa, in terms of ECOWAS, has always been coordinated in terms of their response to any situation. Keen to find out, in terms of the coronavirus, what has been the regional response to the outbreak?
Well, I think ECOWAS, the regional response has been massive. For example, you know, the West African Health Organization, WAHO, the Health Institution of ECOWAS, actually reportedly distributed like over 30,000 diagnostic test kits to the 15 ECOWAS member states. And according to reports, ECOWAS also distributed about 50,000 specimen transportation kits, 10,000 personal protective equipment too, and some medications to member states. You know, the WHO has also been very, very active in bringing together member states to adopt a regional approach to the pandemic and to support them as necessary. Don't forget also that this body, that's WHO, is also taking the fight of COVID-19 is taking the development, the operational guidelines, you know, for the fight against the pandemic in the region. And lately also they've been conducting some online training for healthcare workers. And if you remember too, ECOWAS authority in early April, actually they came together, all of them member states, to discuss the impact of the pandemic in the sub-region. Although this discussion, the vocal points of the discussion was actually the economic impact, you know, of COVID-19 in the region.
Shared problems on the continent, especially when it comes to frontline workers. There's been reports that the government is not responding to the cries of healthcare workers. What can you tell us there?
Yeah, the problem of the frontline health workers, you know, this is the problem they face, and it's actually quite unfortunate because Africa as a whole, and we cannot afford to actually lose any of our health workers because we actually don't have enough, by the way. So in Nigeria, for instance, the federal government has promised that caregivers we get 50% of their basic salaries, although this is yet to be implemented. And according to our minister, he did say, that is the health minister in the country, Osage Hanure, actually did say that the delay was due to some paperwork And looking at even Lagos State, for example, also has increased the allowances of health workers because it's also there are some states that actually especially in Nigeria, they are rising up to the task. Even in Africa, there are some states that are rising up to the task. For example, Lagos State says, okay, the daily allowance for health workers, the frontliners, it was 5,000 naira. Now they've increased it to 25,000. There's some other states like Kaduna in Nigeria, and also states like Kwara, they've increased. They continually increase because there are countries and states in Nigeria that are beginning to realize that there is need for us to actually take care of most of our frontliners, which are health workers particularly. Like I said, already we don't have enough in Africa, in the continent. So we cannot just afford to lose any of them, any of these frontline health workers, to COVID-19. So it is very imperative for us to actually increase their wellness. And they must be reassured if we want them to actually join the fight of COVID-19 in the continent.
Right. Very quickly for us, a very bizarre story, execution by Zoom.
Oh, execution, the Zoom execution story. Yeah, the virtual courts for me, I think during the coronavirus outbreak, actually showed a bit of commitment to accessing justice, which I think is actually highly commendable. But the problem is, according to Amnesty International, there are 3,000 people on death row and in Nigeria, and although this does not really happen every time, and the last execution actually took place in 2016. So the question that people are asking is, can we say can we say the justice was done in this case? Did the public have access to the session? Those are the questions that we should be asking. Then the processes that led to the virtual sitting, did they follow the principle of the natural justice and fair hearing? So these are issues that yes, it's good. The virtual court is good, and many countries in Africa, they are beginning to adopt it. But then, how fair will all of the hearings in all of how fair will it be? Then will the people be able to look at, okay, normally, will the people be able to,
Unfortunately, Abdel, I have to come in there. Time is an enemy. I really do apologize to you and to you, our viewers. We'll try and set up another time to chat more about this Zoom justice. Abdel Kolade, a journalist from Lagos State Radio Service in Nigeria.